It's Thursday mid-morning, and the accident and emergency section of the Aga Khan University Hospital in Nairobi has been converted into a COVID-19 medical battle zone. It's a simulation, a drill to see just how well doctors, nurses, cleaners and administrators here would manage dozens of COVID-19 patients within a 2-hour window. Every 20 minutes, 5 patients are wheeled in. They arrived with varied severity of the coronavirus disease. The emergency room must quickly work through their needs and place them either in general wards or the intensive care unit.
ICU is full, so we need a bed for this patient.
It may be a rehearsal here, but it's the reality in many countries worldwide. Even those with much advanced healthcare systems have crumbled, with medics struggling to attend to thousands of COVID-19 patients in a single day.
Breathe in and out. In, out. Good, you're doing very well.
For the patient, every breath counts. But the doctors and nurses may not have a chance to catch a breath.
We need the bed to come.
The drill is simple. Receive a patient, stabilize them, wheel them into the ward. But everyone must protect themselves from possible infection. And so, it is clean, sanitize, disinfect. Disinfect all wheelchairs, beds, surfaces, walls, doors. Nothing is left to chance.
Take all these places, especially the high-touch areas, because to prevent the contamination. I have to do this one after every 15 minutes.
If these numbers were to become a reality, many hospitals wouldn't hold. At Aga Khan, they've had to think of additional bed space in preparation for the worst.
We have increased the capacity from the 300 beds to 400 beds because we believe this is the maximum number of beds that we can have to provide safe care for the patients.
It's been a hectic 2 hours, in fact bordering on complete pandemonium, as medics here tried to imagine how they would be able to manage an influx of COVID-19 patients. And it's really difficult to imagine if all these isolation wards were full of infected patients, and if the isolation ward at Mbagathi Hospital was also full. What about other private facilities in the country? What about county health facilities? What if they were receiving very many COVID-19 patients? It's really hard to imagine if our healthcare system would be able to manage such a crisis and how well we could treat all these patients. If the situation in countries like the United States of America is anything to go by, then one crucial thing that Kenya must think of is having enough ventilators for ICU patients.
We have found a way to put 4 patients on 1 ventilator. However, we think it might not be practical because we will have some issue with the oxygen supplies, but definitely if worst case scenario, we can put 2 patients on 1 ventilator.
At the ICU unit, the drill continues. Here, these 2 patients are hooked to 1 ventilator. The hospital hopes to use this innovation as a last resort to keep patients alive when there aren't enough ventilators.
We will not be doing this if we have enough ventilators for the patients that we have. But as the COVID crisis continues to worsen, we want to have this as a backstop measure available for us.
When you split the ventilator between either 2 or 4 patients, what are the risks that are there? Because I know there's been a bit of controversy over that subject.
If one patient develops significant deterioration, it could affect how much volume or how much pressure the second patient is experiencing. So in our case, in conjunction with our medical department, we will be setting up the ventilator to where we can individually monitor what each patient is receiving.
Kenyan hospitals know that all these scenarios are highly possible in the country. And as government health officials battle to flatten the curve of infections, health workers know that they may soon be staring at scenes like this in the coming weeks. Asha Mwilu, Citizen TV.